Hi guys, this is Dr. Jamal, and today we're going to be talking about whether the coronavirus lockdown policies are working. Are the lockdown policies effective? It's not normal to close down schools, and it's not normal to close down playgrounds. It's not normal to close shopping malls and restaurants. In fact, it's not American to close down shopping malls and schools. We even gave up on our freedom for a few months, and we still do. Our ability to move, work, and function fully have been hampered by this unforgiving pandemic. There's no doubt that the COVID-19 pandemic has challenged and transformed societies worldwide. The total number of people who have been infected by this virus is around 14 million, and this is looking at the global numbers. Again, globally, the number of people who have died because of this virus is around 600,000, and most of this death comes from the United States, and this number is based on today's recording of this video. Brazil is second, both in terms of infection and in terms of the total number of deaths. Many countries that have put strict measures in place have come on top, meaning they are starting to open up their cities and states. A few people have gotten rich from the pandemic, but more people lost their savings and their future. Yet countries and even states like Florida, with relaxed rules, are seeing a resurgence of the virus, meaning we're seeing an increase in the number of people that are infected with the virus. The question is this: are the lockdown policies working? While the answer differs based on politics or economic consideration, the science is very clear. Based on emerging studies, yes, we have saved millions of lives. Just to give you an example, the Imperial College of London did some research using mathematical models, which is a good approximation of what's happening. Based on that study, we expect to see around 670,000 days in the UK, 470,000 days in Germany, and around 500,000 days in Italy. What actually happened? Based on the Johns Hopkins University tracking system, by late June, we have 42,000 people who died in the UK, 9,000 people who died in Germany, and around 35,000 people who have died as a result of the coronavirus in Italy. And these numbers are significantly lower than the projected numbers that I mentioned earlier. While there has been significant economic damages, millions of more lives could have been lost if there was no national lockdown policy in place. Also, the virus is new, which means we have less means of control, and there is no effective treatment. Thus, if more people became infected, the healthcare system could have collapsed easily, which means more deaths from other diseases due to shortage of healthcare personnel and also hospital beds like the ICU beds. The reason we see mixed outcomes in countries like the US is because of differences in local governmental responses. Some states open early, while other states put in the lockdown policy early in the course of the pandemic, and that resulted in different outcomes. We are yet to assess the full extent of the damage brought by the coronavirus pandemic, and we are still in the middle of the pandemic. Yet we can only imagine what could have happened had we not instituted lockdown as a policy. What do you think of the lockdown policy? Could we have implemented a different policy if there was treatment for the virus? Do you think there was a better alternative to the lockdown? Leave us a comment after watching this video. Please don't forget to wash your hands with soap for about 20 seconds. Do not forget to wear your face mask whenever you are in a public space. I cannot emphasize this enough. Maintain social distance and stay safe, and we'll see you our